We're missing a couple of committee members, but they'll get here as soon as they get here. And I wanted to welcome everybody to the first meeting of the Additional Resources for Transition Age Youth and Foster Care Committee. That's quite a mouthful, but we're calling it the Aging Out Committee for shorthand. And I'm going to ask Senator Payne to open us up with a word of prayer. What's your mic?
Number 8. The Aging Out Committee does just mean because we're old.
But
Okay.
some of us are aging out for sure. But
If y'all would, please join me in prayer. Dear Heavenly Father, we thank you, Lord, for all your many blessings, Lord. Thank you for the breath of life that filled each of our lungs this morning with a plan and a purpose for each of us this day. Lord, we just ask you to guide us and lead us throughout the deliberations of this committee as we go forward. Open our eyes that we could do good in your eyes, and so that we would serve the kids of our community and in our state in the best way possible. We just ask you to lead us and guide us, and we ask all this in Jesus' name. Amen.
thank you. Okay, so there are a number of study committees meeting this week, and things are starting to get very busy. There's also another meeting that's not in town that a lot of people are going to. So this meeting will definitely be over no later than 12 noon. That may not be true of some of the other meetings, but today we have a hard stop at 12. I want to thank Lieutenant Governor Burke Jones for his interest, and Enos Owens is here representing Lieutenant Governor's office for prioritizing this issue and other issues of this very vulnerable population. And when all the committee members are here, we'll ask them to introduce themselves. And go ahead and start by introducing yourself.
Okay, I'm Senator Chuck Payne. I represent the 54th District, which is Whitfield, Murray, and Gordon counties in Northwest Georgia. And prior to that, for 30 years, I worked for the Georgia Department of Juvenile Justice as a caseworker for 30 years.
Thank you. And I'm Kate Kirkpatrick. I represent Senate District 32, and that includes about half and half Cobb and Cherokee counties. And you know, a lot of our senators have huge districts based on the population shifts. And as you probably know, we all represent in the Senate about 200,000 people. I'm expecting that we're going to have 3 meetings at least, and possibly a 4th. The next meeting is on the calendar for September 10th, same time, same location. And anyone who wishes to testify at one of our other meetings, not today, but one of our other meetings, or provide information to the committee, there are sign-up sheets in the back of the room, and we'd like to have your, not just your name, but your contact information, your email address, and your phone number so that we can reach out and set our agenda up for the next couple meetings. I also wanted to let you know that there's going to be a web link for this committee that is not quite ready, but will be ready very soon. And we will put all the presentation materials on that web link. So you guys can reach out next week to Hannah Holcomb, my assistant, and you can either call our office or send us an email, and we'll send the web link out so that people can view the presentations that we're going to have today or any other day. We have another committee member that's joined us. We'll get her to introduce herself. Senator Parent.
Thank you, Chairwoman Kirkpatrick. Good morning, everyone. I'm Senator Elena Parent of the 44th. I represent parts of DeKalb and Clayton counties. Happy to be on this committee.
Thank you so much. We're not going to take public testimony today. I've already heard from a lot of people, including providers and members of the public, that want to participate in the committee. We don't have extra time for that today, but we do want to hear as much input as possible. And so when people sign up to testify, we're going to ask them to plan on being concise and also in coming to us with solutions and not just problems that they see. The purpose of this meeting is to set a baseline for where we are with this population, work that's already been done, and opportunities for improvement. This will allow us to identify gaps and start working on solutions. We'll need to wrap up our work by December 1st and a report outlining what we've learned, and our recommendations will be available on the Senate website when it's approved by the committee. The recommendations may include legislative proposals, process changes, or funding allocations. And some of you remember when we did the first study committee meeting, some of the recommendations turned into bills that have subsequently passed, and some of them were more in line with other things that we can do to make the system better. So not everything needs legislation. The committee takes this work very seriously. We look forward to hearing from our experts, including those who regularly work with this population. Today's agenda includes testimony from the Casey Family Foundation. I'll talk more about them in a minute. The Department of Family and Children Services, and our Office of Policy and Legislative Analysis. We'll also hear from the Multi-Agency Alliance for Children and from 2 young people who have lived experience in the foster care system. With that, I'm going to introduce our first speaker, Christine Kalpin, who's sitting at the table in front of me. And she's one of 3 people who joined us from points far away from the Casey Family Foundation, and they can explain a little bit more about what they do, but I really appreciate them flying here. I run into them at various meetings focused on child welfare all over the country from time to time, and we've gotten to know each other pretty well, and they have a lot of useful information that can help us here in Georgia. Dimple Patel and Carol Self, just wave. Yeah, they're here to help. And our speaker today is Christine Kalpin. She's the managing director for Casey Family Programs. She's been working there since 2011. And I'm going to stop there and hand you the floor. And she does have a PowerPoint presentation that you can view on the screens. And again, the presentation will be available on the website when that's up and running by next week. Floor is yours, Christine.
Thank you so much, Senator Kirkpatrick, Senator Payne, Senator Parent. It's a pleasure to be here with all of you. I want to thank you for the engagement and the opportunity to be a part of this very important conversation. Again, my name is Christine Kalpin. I work with Casey Family Programs. We are the nation's largest foundation focused exclusively in the space of supporting youth in foster care and their parents. We were created by Jim Casey of United Parcel Service back in the 1960s from a very basic understanding that he saw as a business person, which was that children who grew up in intact families did better. And so his idea was to support, through his philanthropic efforts, opportunities to provide resources in communities, jurisdictions that helped children thrive. And so we have a long history. We are headquartered in Seattle, Washington, and spent the first 4 decades really focused in the space of being a provider of services for this population, for older youth, which we operated through our field offices. We now have shifted away to some degree. We still provide services to youth in a smaller number of offices, but spend a considerable amount of what we have through Mr. Casey's generosity in partnerships with jurisdictions. We're a little unique, I think, in the space of philanthropy in that we were created as a foundation that was intended more to think about resources not in such a grant-making way of simply providing necessary resources, but rather how could we walk alongside and partner and be engaged in the work? And it's that spirit that we bring to this. We are incredibly grateful for our longstanding partnership with the state of Georgia, with the department. I see a number of our colleagues that we work alongside daily. We have, in that model, we have a consultant who is assigned to work and be a resource to Georgia. And the idea with that is both to be a thought partner, but then also to bring all of the various resources of our foundation to this work. And it's in that spirit that I'm here today. This conversation around youth who have grown up in foster care has been one that we have been really paying a lot of attention to for a very long time. Again, as a provider, most importantly, what we always wanted to be sure we were doing was making investments and supporting programs that really helped these youth and helped their families. And the next two slides that are in my deck center this conversation from a lens of uplifting, I think, the outcomes that in the population of youth that we're talking about today, when we talk about youth aging out, typically across the jurisdictions and in Georgia, we're talking about youth who we begin talking with them about transitions as young as 14, but then typically provide resources up until they're 21. And so a lot of what I'll be referencing in are outcomes that we look at among youth ages 14 to 21. And I think as you'll see from these two slides, these outcomes raise a lot of questions for us about what we can be doing to hopefully do better. The struggles in mental and physical health persist. Education and training, the concern about having a high school diploma or even a GED, which data is clear is such an important indicator of success, is something that we're still really tracking and concerned about making sure our youth in foster care and those aging out achieve. Employment, finances, economic hardship. The employment statistics among youth who age out are not where we want them to be. And they struggle with some areas that we know are important to them. So for example, the data I have here point to almost 1 in 3 of them who shared in this survey that they felt unable to pay their rent or a mortgage, which we know is such a critical aspect of security for people is housing. Living arrangement, the population of youth who age out nationally, homelessness, housing instability still remains an ongoing struggle. Connecting them is still an important area to keep talking about. And then criminal justice involvement. The pathway, the pipelines, the connection between our youth in foster care and experiences with crime or other issues is just higher than we want it to be. And these are the conversations that we're having as we're really trying to think about, as the government who's taken responsibility for these youth, what is it then that we should be thinking about are important indicators to keep our eyes on, and what should our investments be focused on if we want to really support them and help them thrive. I want to spend a little bit of time. I live in Washington, D.C. My experience has been sort of over 25 years in the policy context there. So I wanted to bring to your conversation some consideration about, at least at the federal, national level, what has this conversation looked like? So 1986 was when at the federal level we created an independent living program. And again, it was sort of the first foray into a dedicated program recognizing we had a population of youth in care who were aging out that we needed to help. In 1999, the concern was raised that there really was not enough money that the jurisdictions were getting from the federal level to focus on this, and we needed a higher attention to this issue. And so 1999 saw federal investment in these programs double to $140 million. And this was also one of the first times we began looking at a statutory level. Typically we look at a youth aging out at the age of 18 and becoming an adult. And for a period of time, it was sort of a very abrupt, you're now 18, you're no longer eligible for federal assistance, our responsibility is no longer there. And there was a really important conversation that was happening about, well, if we have a population who are going to experience this, what should we be doing? And how soon should we be doing this in terms of helping them? And even as early as 1999, we began talking at that time about allowing jurisdictions to begin having these conversations with youth about the idea that they may transition out of the system without permanency as young as 14. And that's something that I think we continue to need to talk about and really begin to understand. 2001 saw the creation of, for this population, a program of education and training vouchers, recognizing that financial support for post-secondary education and training was going to be helpful for them. And A lot of what I'm uplifting here really has come from the youth who have experienced the system telling us what could have helped them, what did they need. And I think there's really been an effort at the federal level and in so many of the jurisdictions by Georgia to listen to that and try to understand, well, what does that mean for where we're spending our resources? 2008, though, began this conversation at the federal level, recognizing that in some jurisdictions we were seeing them notice that really at 18, we can't expect these youth to simply transition to adulthood and not continue to have any type of resources. And seeing that financially providing support to them was an important thing we could be doing. It began the conversation in 2008 of giving states the option of saying, if you would like to allow children to remain in foster care until 21, the federal government will partner with you in this and help provide resources to you to continue to provide them support. Again, it's a state option. It is something that Georgia does. It is something that a lot of jurisdictions do. And the research is pretty clear that continuing any involvement and any financial support to them does help them. And then in 2018, most recently, what they began recognizing, though, is if you'll notice, the slide before talked about foster care independence. We were talking about this independence in a more general way. But in 2018, the federal conversations shifted to an idea of talking about a successful transition to adulthood and the idea of being much more of an active, engaged partner and really thinking about not just preparing them to live independently, but what could a transition look like and what is it that we should be doing. The next slides here are intended to provide a little bit of a national landscape of data. I want to be upfront that, and to thank Georgia for their partnership with us. They've been an incredible, they've engaged alongside us in allowing us to have access to their data, to be a partner with this. They have an incredible dashboard online that can give you a number of data points in real time that I'll point to. But for purposes of sharing some of the national information, these data go back to 2023. A lot of the trends are still the same, but I wanted to just recognize that. So most importantly, what you'll see here is compared to the national trend, which has been, this data here shows the number of the rate of children entering care. And positively, what we're seeing here is a decline, both nationally and in Georgia. This slide, though, which is from the Georgia dashboard, shows that from 2021 up until this third quarter of 2025, in Georgia, there's been around 500 kids every year aging out of foster care. And I share that because, again, this is a trend we're seeing nationally. We're seeing the number of children in care going down, and one of the outcomes that concerns us is that we're not seeing a decrease in the number of youth that were aging out of care. We've seen sort of a steady trend in that population of kids. This data for 2023 shows what oftentimes for children who come into care, they may have multiple entry points. They may come in more than one time. But we wanted a sense, again, of, well, how long have they been in care in terms of really thinking about the opportunities that the department had to be engaging with them. And this data show that, about half of the children who aged out entered care most recently at the age of 16 to 18. So that's about a 2-year period. But 40% had entered as young as 13, and then 17% of the kids have been in care as young as 6, which means that they would have entered care at 6 and been in foster care aging out at the age of 18. The reasons for entry, we wanted to look again nationally, and these are the data for Georgia, but these categories are indicative of what all the jurisdictions are seeing, which is for the children who are aging out, what were the circumstances that brought that child into care? The number one reason nationally is this category we call neglect, which is generally a category that includes a whole range of areas that could include anything from challenges that the family may just be experiencing, but a neglect that warrants a concern we have about safety. And that's why we're engaging. What is unique among the older youth population is 1 in 3 come in for child-related behaviors. And this is the struggle we're seeing nationally with our adolescents around mental health and behavioral health reasons. And we see behavioral health as a reason that children are coming into foster care. There are pathways for resources that children get when they come into foster care to behavioral health. I think part of the conversation we want to have is, are there other ways, though, to really think about addressing the behavioral health needs of youth that does not warrant them having to come into foster care? And is that something else that we could be thinking about? What do we know about the youth aging out and what
Christine,
they're
before you go
Yeah.
on, could I just ask you to comment on inability to cope,
Sure.
what that means?
I would certainly defer to the department here because it varies nationally, but it's a category at the national level that basically is sort of a notion of, in some instances, it has some overlap with abandonment. So it's a population of parents and a reason of parents. Unfortunately, the data is clear that we do have parents who are saying and are relinquishing custody of their children to the department because they are unable to provide the resources they need. And so an inability to cope is largely a category of we don't have the ability to provide the resources to these children. I think this is a category that, again, unfortunately is there a better way to help that family that maybe wouldn't require them having to relinquish custody? But that's largely what inability to cope is. But I would certainly, okay, sure.
So while
Yeah,
I
sorry.
stopped you, I'm going to ask Senator Hatchett if he could introduce himself.
Thank you. Senator Hatchett, Bo Hatchett. I'm from Habersham County. Glad to be on this committee. Grew up, I had 2 adopted siblings. My mother's a foster parent. I have 4 little girls myself. I'm also an attorney. And just thank everyone for being here. This is a very important issue, and I'm glad we're talking about these issues today.
Thank you. Okay, keep going. Thank you.
Sure, thank you. This for 2023 shows for the youth who are aging out, what was their placement? So we capture at the federal level placement settings in terms of understanding when we bring children into care. Oftentimes the research again is clear here that children thrive in the most family-like settings. And so what's been positive has been so many jurisdictions and areas are really focused on what and how can we get children into the most family-like settings. For youth who are at risk of aging out or who do age out, jurisdictions have also been really clear, though, about the real challenges in finding family-like settings. And we do continue to see a higher percentage of this population in the federal category is called child care institution. And that's what you see here. This is essentially a home or a larger sort of group setting that allows children to be placed together. And that is something that there are ongoing conversations about making sure that for the children who really need that level of care, we're making it available, but concerns that because of the lack of either other placement settings for older youth or the lack of available services that might allow an older youth to stay with their family, the only available settings are group homes or other things. And what can we be doing to really be sure that a child is in the right placement if we've had to take them into care? Again, this is a slide intended to show that the challenges that we have with the youth aging out continue to be something that is just, we're still not making the dents we want. Because you'll see this trend line goes back to 2014, and both nationally and in Georgia, this is median days to exit. And so this is for children who've aged out, on average, how long had they been in care before they aged out? And nationally, it's a little over 2 years. For Georgia, it's a little closer to 3 years, which means they had been in the custody of the department for at least 3 years before they aged out. And one of the other areas that I think in child welfare that we've really been trying to focus on and understand better, and I think within, again, the population of youth who are older, it's been even more of a struggle, is when children thrive when they have stability, right? When their families have stability, when they have stability. And so one of the national indicators that we look at a lot is how many times have we moved a child in care? How many times has there been a disruption in their placement setting? And there are very important reasons why sometimes a placement setting will disrupt. But what concerns us about it is that the research is also clear that every disruption typically leads to a longer period that a child will be in care, because it means typically that they've had a lot of instability, they're struggling with challenges that we're just unable to meet. And I think the part of this that concerns us is, again, when you look at the data, and this is 2023, but the median number of placements for a child who had been aging out of care was they had been in 5 placements, which means they had moved to at least 5 different settings prior to aging out. And that creates a host of challenges and services that then when they're aging out are needs that we really need to be attuned to and really thoughtful in terms of providing them support. I do not expect, I wanted to put on the next 2 slides, I earlier talked about at the federal level that the dedicated federal program we point to often as a dedicated source of funding to support this is the Chafee foster care program. That program gives money to all the jurisdictions as a block grant. The states are required to put up some money as well, but then they're given flexibility to determine what the best way to spend those funds are. And so I wanted this select committee to simply understand at the federal level, what does federal law say are the purposes? And so as you're thinking about where opportunities may be within that pot of money, what are some of the ways these funds can be spent? This first slide, the first bullet is largely saying, we want you to support these youth. We want you to spend these dollars in ways that will support them in their transition. And you can do that as young as age 14. The next slide says, though, permanency. We know that having permanency, having some type of individual you can call when you need services. So permanency obviously can look as though it is an adopted family or a guardianship or a very permanent connection. But the youth have also been clear that for them permanency is just having the connection to an adult or a trusted individual who knows them, who can be alongside them. And there are lots of ways to look at that. Within the child welfare space, we call this relational permanency, this notion of it's about relationships. It's about really helping them. And it is something that you can spend federal Chafee dollars on. And then this third area is a space that the youth, again, really came to members at the federal level and talked about, I can't sleep over at a friend's house. I can't get a driver's license as a foster care youth, right? So it's an area of, we love our jargon at the federal level, so we call it developmentally appropriate activities. But it was the idea of saying, help them be 14-year-olds, help them be 15-year-olds, like help them recognize that the best thing we can do to help them when they're 18 is help them thrive when they're 14. So you can use these dollars to do that. These areas here, again, align to other more concrete spaces of you can use these dollars on housing, you can use them for services, and most importantly, again, recognizing, and this is something Georgia does do, is think about, don't stop at 18, you can do this up to 21, stay with them longer, provide resources, think about ways to really help them thrive. There's language again here about the voucher program I referenced. And then the important thing here too was, because these resources are helpful to youth, there was a recognition that even if they left foster care or were adopted after 16, we didn't want these resources to stop. So we wanted to give we did not want there to be any disincentive to a youth at the age of 16 or 17 deciding they wanted to be cared for by a family. And sometimes these resources were critical to them. And so saying, absolutely, achieve permanency, we're not going to stop these resources. You can continue to provide these types of resources to youth even if they have left care. This slide here is just, we wanted to give a snapshot of what Georgia, the various categories of resources they've been spending their putting a focus on. So again, there's a lot of information on this slide, but it's intended to show a number of the various ways that Georgia at this time is choosing to provide resources to transition age youth. And you'll notice the numbers here, even for 2023, they were serving about 3,800 youth with these resources. And so again, very constant, an area that they're continuing to focus a lot of resources in, and we can certainly talk more about this. These last few slides, again, I think I wanted to just make sure I spent a few minutes giving you a sense that this is still a very emerging conversation in terms of really understanding what federally we can be doing and what is it that jurisdictions need. So at the federal level, the Government Accountability Office was asked to look at how can the federal Health and Human Services Department help jurisdictions with this population? And so in January of 2025, they went out and spoke to 4 or 5 jurisdictions and did a landscape analysis of independent living programs, and largely directed that what the federal department really needed to be doing more was addressing some barriers that the states are saying are preventing them from serving transition youth. And so I think there still remains a lot of opportunity here at the federal level for the federal department to be engaging and doing more. But I wanted to also set the context that this really is a national issue, and it's incredibly exciting to see your committee think about this and really focus some attention on it. And we're happy to really be a partner in you doing that. I wanted to also, again, just set some context because I recognize that the slides at the beginning were, 2009, 2010. But this is a report that you may consider spending some time if you haven't already read this. There's an organization called Think of Us at the national level that back in 2020 really went out and talked to youth to understand how are we doing? Like, what has your experience been? And then they reissued the report in 2022. And this is sort of a snapshot from the executive summary. And they found that nationally what youth say is that they just still feel as though the system leaves them unhealed, unprepared, and unsupported. And they lifted up 3 areas that youth really leaned into as conversation spaces to be talking about. Healing and dealing with trauma, which is an aspect that both they bring. Unfortunately, as I've said, if we know that 1 in 3 of youth who age out come in for behavioral health reasons, and we know that there's instability in their placements, the challenge of behavioral health and continuing to support them is something that unfortunately is just very ongoing and really needs just concerted effort. The second here is a preparing for adulthood category, and this is where education, training, anything that would help them recognize as a 19-year-old, what could help you to thrive. And then the third area is really building that supportive network. The other thing they mentioned here that I think is something for us to keep talking about, and why we also really encourage jurisdictions as they're having this conversation to recognize that continuing to really engage with them and talk with them and get data is critical, because the youth who were interviewed in 2022, they indicated that their needs were intensifying, which means that what a child aging out of care looked like in 2015 looks different than what the needs are of a child aging out of foster care in 2024 or 2025. And we need to understand that in particular, and I think this is what the national conversation has really been uplifting, the mental and behavioral health resources and services for them is a very critical area. We still have a way to go in housing instability. We still just have a lot of ongoing conversations that are important to have. So before I turn to questions, what does this mean for Georgia? So 3 things to think about as you're continuing to talk about this. Youth will say time and time again, no one talked to me about what I needed. And we have a system that isn't always aligned with providing services that actually match what the youth would say would help them, right? We're oftentimes, and we're really good at this at the federal level, which is saying, like, here's what I can offer, without saying, what do you need? How can we help you? And I think where the opportunity is that Chafee is so broad that it would allow that chance to say, how could we help you? What would be most helpful to you? Like, how can we help you achieve this? And so what does that mean, again, to learning from them? Is what we're doing from a support and service provision adequately helping you? Like, is this what you would have asked for? Or are we enrolling you in programs that we have been providing that just don't meet your needs? Because that's all we have. How do we make sure that the service array we have actually aligns with what the youth right now tell us? And then the last piece of this is the conversation about extending time and care was also from a lens of recognizing the longer we stayed connected with them, the longer we could think about helping them find permanency, and really thinking about that there remain opportunities to create relationships and continue to have that discussion, and what can that look like. So with that, I'm happy to answer any questions, and again, thank you for the opportunity to be here.
Thank you. Greatly appreciate your presentation, and also your colleagues that are here with you. You're doing good work, and I think we're working together on trying to make things better. I wanted to just make a couple comments and then ask you a question. One is kids that have complex behavioral and mental health needs. We've just opened a sort of a crisis center down in Macon of inpatient residential treatment, and that's something that we're pretty excited about, because a lot of the kids in Georgia that ended up in hotels were those kids. They were kids that just had really complicated needs. And so I'm sure you're seeing that nationally. I'd like your comments on that. Also on permanency, we realized in the process of working with our department that the time to permanency is really important, and that one of the problems we had in Georgia was that we did not have data from the court system, from the juvenile court system, about how things were going and how long this process was taking. And so we passed a bill, I guess 2 years ago now, that required reporting of certain data points, not just to the court system, but also to the legislature. And what we realized is that a lot of counties were not set up. They didn't have the systems in place to do that. And so we allocated $650,000 to make that happen. And I think that process is starting to get completed, so that we will have some data, so that we'll know what the issues are with permanency. And because the data is always the key to understanding what's going on. But my question for you is also about prevention. And one of the things that our committee, the Children and Families Committee, has talked about a lot is how to keep kids out of the system to begin with, because that just is the beginning of the whole cascade of issues. And I'm sure you guys are working on that, but I would be interested in your comments about that.
Sure. No, thank you. I think actually your point number one about the complex mental health needs and the prevention piece go hand in hand, because what we've been working on, I think particularly within this population of older youth, is again, when federal foster care was created, it recognized that we wanted to bring children in for safety-related reasons. If we felt that child could not be safe at home, we should be engaging. So I think what we've been having a conversation about is, if we're bringing children in for behavioral health services, why is that becoming an issue within child protection, and where are the gaps in behavioral health? So what I would say nationally is that, one, understanding that, to your point, we need very specialized crisis intervention services that can provide the types of placement setting that youth need. So we certainly applaud the efforts that are underway. That's exactly the direction we need. We need settings that allow for these children to have stability. I think there's also a conversation that we're having, though, which is the youth have also said oftentimes, I've been provided a much higher level of placement setting or service than I needed. What I needed was more of a mentor. What I needed was for me to be able to we talked about the inability to cope or others. The notion that we have parents relinquishing custody of their children to a system for behavioral health reasons is something that isn't necessary. I'll be very transparent about this, and I'm happy to talk more about it. There are federal programs that provide resources that allow children to remain at home with their parents, that we can give them evidence-based mental health services. We no longer have to have children relinquished into custody to get behavioral health. And I think that's the piece of this we want to understand better, is where are the gaps to getting those resources into the community to allow that child to safely remain there so they don't have to come into care. And we have a lot of resources on looking at complex children, looking at behavioral health issues that we'd be happy to keep talking with you about. But it's certainly something that we're very dedicated to and we want to keep talking about.
Yeah, and just to follow up on the reasons that kids go into care to begin with, it's not all mental and behavioral
Right.
issues. A lot of it has to do with a house of cards situation with a family where they just something goes wrong. Somebody gets sick, a divorce, a loss of a job, or whatever. And a lot of those kids end up not because of abuse
Right.
and neglect, but because of the situational, things that go wrong. And so that's the other thing that we've been talking about in my committee is how to support families. In fact, we passed an increase in child care tax credit this year at the state level, which every little bit helps, I guess. But I don't know if you've had those. I know you all spend your life working on this, so I'd be interested in what you've been thinking about that.
No, I thank you for that. So again, the research is really clear that addressing very, very concrete needs of families, such as childcare, housing. To your point, folks talk about sort of one financial emergency away from really being in the need of resources. That if we do support economic stability of families, we have seen a reduction in the number of reports to child protection, because there is a category of children who will come to the attention of departments simply because of a lack of a material need. And that's an important area to keep talking about is, do we have families who are simply having teachers and others are very concerned about children. They want to make sure children have what they need, right? But what's the best way to get them that need that isn't a child protection investigator on their door, right? There's a group of families, and your system will work better to protect the safety of your youngest children if the workers are not called in to investigate families who shouldn't be in child protection to get the resources they need. That's the prevention conversation. Is there's a lot of way to meet material hardship needs of families that shouldn't be a call to CPS. And then that allows the calls to CPS to really go out and investigate. The highest risk of safety are the 0 to 5. The system should be focused on the protection and care of the youngest children, right? They shouldn't be. The behavioral health needs of these children should be a much more of a behavioral health insurance conversation, not necessarily a CPS conversation.
Yeah, we've got our Commissioner of Department of Juvenile Justice here, and we've got our Office of the Child Advocate here, and I know that a lot of the judges struggle with the CHINS population, the Child in Need of Services, that are dropped off at 4:30 on a Friday afternoon, and kind of what to do. So that's one of the things we're working on here in Georgia.
When I would say, too, it would be helpful, as you all are doing that, to understand if there are barriers at the federal level, because I will say part of the challenge for states and jurisdiction is federal fundings come with strings, right? So for the longest time, the string was you'll only get federal resources if you remove that child. And that was problematic because it created a whole sense of a system built on removal. Fortunately, we're now moving into saying we want to partner with you in helping to prevent that removal, all of which is great. But those resources still come with strings. And so to your point of it's 4 o'clock, in order for this family to stay here, we need X. The question is, do you have the flexibility to do that? And if you don't, then how could we help you to address that 4 p.m. Friday need, right? And I think that's still an ongoing conversation.
Thank you. I think other committee members have questions. Senator Hatchett?
Yep, thank you. And thanks for being here. I was wondering, can you point me to where we can find information that we can share with our constituents about the federal assistance programs for mental health?
I'm happy to follow up and share with you some of that, because I think there's a whole host of, I would want to spend a little bit of time getting you the right resources. So for mental health, both for, because I think we'd want resources both for the caregiver as well as for the youth. And so let me follow up and provide that information.
And just to follow up on that, is there coordination right now between DBHDD and DFACS on mental health issues?
I would want to defer to the department on that, if you don't mind. Just,
Okay.
yeah.
We're going to hear
Fair
from
enough.
them in
Yeah,
a little
so-
bit.
Okay, sorry, I'm getting ahead of myself.
No, that's,
Yeah.
I will say at the federal level, we're constantly encouraging them to do better at it. So it's something that I know at the federal level, they don't model well, but I do think the majority of jurisdictions have really been trying to partner and consider how they can better work together. So, but I would
Okay.
want to defer to them.
Awesome, thank you.
Sure.
Senator Payne?
Chair, kind of just go back where I was thinking when you were going through when you're talking about the inability to cope. You made the comment, you said parents unable, and so is that based on parents who are actually unable or parents who just don't want to?
The data doesn't allow me to pull that aside. I think anecdotally, I would say we've heard examples of both.
Because as a probation officer, and I said it to people all the time, I said I never want to choke a kid, but man, there are plenty of parents I'd give anything 15 minutes alone with. Just because, well, the kids we have in our system so many times are the result of selfish desire of the people who are supposed to be caretakers.
Right.
And that's why they wind up in foster care eventually. It's not just because, and that's the frustration with a lot of it, is how do we get to the point where we can hold parents accountable for being good, for being parents. I mean, when I, as a juvenile probation officer, when I get the phone call being on call on the weekend, I get a call at 2 o'clock in the morning where little Johnny's out running the streets at 2 o'clock in the morning. My first question is, where's the parents?
Mm-hmm.
Because they've not made a phone call saying he won't come home. They're not making a charge that they're content with him being out of their hair.
Mm-hmm.
So as long as he's not in my hair, then he's out there running the streets. At some point, it's just that's the frustration part I think from DJJ's side is literally we're having to contend with the kids when the kids are not really the problem. The kids are the results of our problem, and get it back to the understanding of first and foremost, parents need to be held accountable for putting those guidelines and those barriers and those safe places for kids to be raised. So how do we get to that point?
So a couple of thoughts, and again, too, I know you have the department here to understand, particularly within Georgia. What I would say, too, is the slide there is a category both of abandonment and inability to cope. And you'll see, I think the abandonment percentage is even higher than the inability to cope. So, and I think nationally there's been a whole conversation about whether or not abandonment really should be a reason for entry into care, but that's a whole different conversation. And I think you're right. I think the aspect of this is really trying to get to the place of research is clear that the earlier we can intervene with the family, the better off, right? And I think oftentimes, unfortunately, by the time child protection has intervened with the family, typically we've missed other opportunities to provide resources and services that could have helped them, that could have potentially prevented child protection. And it's important that we don't have children who are in unsafe situations, right? And that it's important that we're protecting them. And though wanting to better understand what essentially may have gotten that family to a place where now they're on the radar of child protection, and recognizing, we think oftentimes that oftentimes the last place you want to be is on the radar of child protection. So it's typically not an agency that a family will come to and say, I need help. Because unfortunately, some of the help we can provide is, well, we have to investigate you and we have to open a case. Are there places in the communities that families can go to and say, I need help? Can you help me with this? That will be trusted and alongside them. And again, recognize that we've created a system in all the states that when there's a reason that we need to intervene, we should. And we need our community members to be our first line of eyes. But I think time and time again in communities across the country, they don't want the only option they have to be, I can't get you services unless I call child protection, because that's the pathway, right? Instead of, we have this community service here we can provide. And so I'm just going to lift it up because it's top of mind. We've been working with an organization in Arkansas called Restore Hope. And it's this notion of, they're trying to put together an infrastructure of people that when you've got that family who just needs help, can be called and provide resources, right? Like sometimes a family is just one person away from, needing a connection and needing someone they can call. And how do we do that? How do we do that in our communities? So that's just one concrete example of it. If that answers your question, I hope.
Senator Parent, you get the last question for us.
Thank you, Madam Chair. So on this reason, given by youth who are aging out that they feel, unprepared is the healing and dealing with trauma. And I was wondering if you could just elaborate a little bit more on what successful interventions on that have looked like.
Sure. I mean, I think one of the evidence-based programs that we've seen some, and I know that Georgia has been leaning into, is there is an organization called Youth Villages that's put together a program called Life Sets Training. And I believe that within Life Set Training, an aspect of that is mental health and behavioral health resources. And then I would be happy to provide a list of other programs that we see that have an evidence base in the space of mental health within that. The one thing that I will say is very helpful for this is that youth who have aged out of care are categorically eligible for Medicaid until they're 26, which means that Medicaid is available as a funding resources for these services. And so as you're thinking about that, recognize there will be federal resources alongside what you provide at the state level to continue health care. And that was recognizing that the stability of health care and health insurance was going to be critical to them doing well. And so that goes up to 26.
Thank you.
Thank you. That was really a very helpful presentation. And I think we've been having some issues in our state, and I'm sure a lot of other states, with mental health parity issues, and that is not in the scope of this committee, but it is something that we're continuing to work on. But great job. Thank you so much, and really appreciate y'all flying in for this meeting, and we'll be leaning on you for more information as we get farther into the process.
Thank you for the opportunity.
Thank you. Okay, next on our agenda, we're going to ask Bailey Sailors to come down and talk to us. Bailey represents our Office of Policy and Legislative Analysis, and she's going to talk to us fairly briefly about some of the work that's already been done from a legislative standpoint in Georgia that impacts our conversation. Thanks, Bailey. Floor is yours.
Thank you. Very weird being on this side of the table for a committee meeting. So I am just going to provide a brief overview of some of the legislation the Children and Families Committee has passed. And a little bit of background on the Children and Families Committee. It was established in 2023, and it focuses on several areas, including mental health, child protection, foster care, and adoption. In the 2023-2024 biennium, 19 bills reached final passage from the committee, and last year in 2025, 8 bills. And the bills I'll be highlighting today, and just the portions of those bills will be the highlights on foster care. And this first bill, House Bill 460, was effective July 1st, 2023. It revises the right to an attorney in dependency and legitimization proceedings. This bill illustrates a common theme throughout a lot of the committee's work to streamline the process on adoption, streamlining the timelines for children entering foster care and those systems. The most relevant portion of that bill for this committee is that the bill provides that a child receiving extended youth services from DFACS is entitled to appointed counsel at all stages of dependency proceedings. Senate Bill 133 was passed in 2023. It creates a uniform process for DFACS to assume custody of children as a result of a child in need of services or a delinquency order. The title of that one is pretty self-explanatory. It creates a uniform process. This bill is also particularly relevant to this committee because in order to be eligible for some of the extended foster care services, a child needs to be ordered as a child in need of services. The next bill streamlined and clarified notice requirements for permanent guardianship hearings. It's another one that demonstrates the theme of streamlining processes and clarifying requirements for these hearings. A lot of information on that side. I have the full bill summaries for all of these with me, and I can email them to y'all if you would like. The next one was passed in 2024. This is Senate Bill 342. It allows a disclosure or use of records from child abuse and neglect registries by DHS in locating and providing services to a child who is determined to either be missing or the victim of sexual exploitation. And it allows the National Center for Missing and Exploited Children to have access to records concerning reports of child abuse for the purpose of providing services to these children. Next one is Senate Bill 376. It was passed in 2024. It clarifies the requirements of parents, DFACS, and the court to improve timely permanent placements. Let's see. This one requires certain findings from the court, and it requires the court to put in its order certain findings regarding a parent's progress toward completing the case. And it also provides that termination of parental rights may not be in the best interest of a child when the child is being cared for by his or her relative, and the relative intends to be a permanent placement. Senate Bill 387 was passed in 2024. This bill requires DFACS to provide youth with identification cards. This is relevant to this committee because it will help youth aging out of foster care. It'll be easier for them to obtain employment or education if they have easier access to ID cards. Senate Bill 401 was effective in 2024. This is the bill that Chairwoman Kirkpatrick was talking about. It implemented several recommendations from the Foster Care and Adoption Study Committee. This is the bill that required the juvenile court to submit data on CHIN's cases and dependency proceedings, list all of the data that needs to be collected and submitted. And it requires a petition to terminate parental rights to be immediately filed and docketed without delay. Senate Bill 483, it updated the interstate compact for the placement of children. Georgia was already in this compact. It just updated the provisions. And this year, Senate Bill 100 was passed. It's Andy's law. It allows an individual born in Georgia to request their original birth certificate. Simple one. And Senate Bill 85 was not passed through the Children and Families Committee. It was a higher education bill, but it established the Georgia Foster Care Scholarship. This scholarship provides grants on a per semester basis to eligible students. And the total per year amount of a scholarship for a student is $30,000. And eligible students can receive the scholarships until they have earned their bachelor's degree, attempted a total of 190 quarter hours or 127 semester hours, or they have received the scholarship for 10 years. And you can see in the eligibility requirements, it's children who are currently in the custody of DFACS, participating in DFACS's ILP program, and other foster children circumstances are eligible. And then the last bill, this is House Bill 136, that was also passed this past session. It's a finance bill. It was the tax credit for foster child support organizations. This bill also increased the child care tax credit that the chairwoman was talking about earlier. This bill increased the annual aggregate maximum for the foster child support credit to $30 million. It was previously 20. So now up to 30 million of the credit can be claimed. It added more qualified organizations to the credit. And then at the bottom of the slide, you can see the amount of the pre-approvals for the credit, the people that are pre-approved to take advantage.
Thank you, Bayla. That's very helpful. And this meeting is being live streamed. And for people who aren't as familiar with our process, we just finished year one of a 2-year biennial session, if you will. And so bills that did not pass this past year are still alive, by and large. So we've still got opportunities. And as I mentioned before, not everything that we do requires legislation.
Mm-hmm.
Some of it requires our agencies to do things slightly differently, or for us to shift money around or allocate more funds. So that's very helpful. And these documents will be on the website that I mentioned earlier, which you'll have access to by next week. Bailey also did a very helpful introductory memorandum on kind of what we've done so far in this area and resources that we have. So thank you very much.
Thank you.
Okay, next we're going to hear from our Department of Family and Children's Services. Don J. Calhoun, would you come on up? We're looking forward to hearing, and you're bringing your friend Mary with you. So you guys can introduce yourselves, and we've got your PowerPoint in our packets. Thank you for being here.
Thank you for having us.
Just speak loudly and close to the mic, please, so everyone can hear you.
Okay, good morning, Chair Kirkpatrick and members of the committee. My name is Don J. Calhoun, and I serve as the Wellbeing and Safety Services Director for the Division of Family and Children's Services.
Hi, I'm Mary Havoc, and I'm the Deputy Chief of Staff at the Department of Human Services and have the opportunity to work directly with the Child Welfare Program at the Division of Family and Children's Services.
So today I'll be sharing an overview of the services and resources we provide to transition age youth as they move to adulthood. We provide a continuum of support designed to prepare youth for independence. This work typically starts by age 14, well before they age out of care. Our two key programs are the Independent Living Program, also known as Chafee, or Georgia Rise, which starts at age 14, and Extended Foster Care, which provides ongoing services to age 21 for eligible youth who opt to stay in foster care. These programs are designed to complement one another, so we encourage young people to participate in both programs. Together, they provide both skill building and continued support to ensure young people don't age out of foster care without the appropriate resources to support them in adulthood. So I'll start off with the Chafee program. The Chafee program is a federal initiative created in 1999. It funds states to help youth in foster care or formerly in foster care make the transition to adulthood. In Georgia, our implementation of the Chafee program is called Georgia Rise. And Georgia Rise stands for resilient, youth-centered, stable, and empowered. Georgia Rise focuses on building stability for youth through education, healthcare, housing, relationships, and employment support. The goal of the program is empowerment. We want youth to have the tools to make positive choices as they enter adulthood. Youth between the ages of 14 and 21 may qualify for Georgia Rise if they have spent at least 6 months in foster care after their 14th birthday and before age 18. Eligibility also requires citizenship or a qualified immigration status. Georgia Rise is a state office unit that is comprised of regionally assigned independent living specialists, which we refer to as ILS staff. They work with our DFACS case managers, and they help assess eligibility, coordinate transition planning, connect youth to resources, advocate on their behalf, and process Chafee-funded fiscal services requests. Our ILS staff are a vital part of ensuring that our young people have the support they need as they journey towards independence. So now I'll talk a little bit about extended foster care. Extended foster care allows young people ages 18 to 21 to voluntarily remain connected to DFACS and continue receiving support. To participate in extended foster care, they must sign a voluntary placement agreement within 5 days of their 18th birthday or request to return to extended foster care if they've previously opted out. Participation in extended foster care requires engagement with juvenile court. It requires the submission of a court report with a written transitional living plan. Youth may qualify if they are finishing high school, enrolled in college, or vocational training, working on and engaged in employment preparation programs. Importantly, youth who leave foster care at age 18 may return up until age 21 if they need support again. This flexibility helps stabilize young people as they take their first steps into adulthood. As of August 1st, 2025, Georgia had just over 11,000 children and youth in foster care. Notably, almost 30% are ages 14 to 20. We currently serve 673 young adults in extended foster care. These numbers show why it's important that we continue to invest in transition age youth services. So this chart shows the number of children and youth in Georgia's foster care system over the past 2 years through July 2025. Overall, our foster care population has remained relatively stable over the past couple of years. Another key area I want to highlight is funding supports for older youth. We provide a range of practical supports that help level the playing field, including but not limited to driver's education, IDs, exam fees, enrichment activities, startup housing costs, and college stipends. On the topic of IDs, I'd like to thank you all for your work in passing SB 387 in 2024 to provide for the free issuance of state IDs for children ages 14 to 17 in foster care. As you all know, having identification is crucial for these youth to access benefits for employment and education as they transition into adulthood. These supports address real-world barriers faced by youth when moving into adulthood. By providing these comprehensive supports, we are empowering them to overcome challenges, build resilience, and achieve at their full potential. Moving on to post-foster care services. Even after youth leaves foster care, Georgia Rise continues to provide transitional housing, emergency financial assistance, and education-related funding. This is essential because we know that independence does not happen overnight. The Education and Training Voucher, or ETV program, is one of those educational supports. It provides up to $5,000 annually for higher education or vocational training. We contract with Embark Georgia to administer this program. Funds can cover tuition, housing, books, and meal plans. In addition, Georgia offers the post-secondary tuition waiver program for eligible students attending TCSG schools. We also have the Foster and Success Act, which provides a dollar-for-dollar tax credit to donors who support organizations serving youth who have aged out. This combination of state and federal support strengthens our safety net. Now I want to take a few moments to share one of my favorite things that we do every year. It's called Celebration of Excellence. It's when we take 3 days to honor youth who have graduated high school, earned their GEDs, or completed post-secondary milestones. Highlighting achievements like these can be incredibly impactful for youth, showing them that their hard work, dedication is truly valued. It not only celebrates past accomplishments, but can also inspire and empower them as they embark on their next chapter, whether that's continuing their education or joining the workforce. This year, we had 184 students in care graduate with either a high school diploma or a GED. 160 confirmed high school graduates, 17 confirmed GED recipients, and we had 7 confirmed college graduates. From the group of students who graduated from high school or received a GED, 48% have plans to attend college or join the armed forces. Celebrating youth who graduate is such an important milestone, but graduation is also when the next big chapter begins, and that's preparing youth for the transition from foster care into adulthood. Transition planning meetings begin at least 90 days before youth exits care. These meetings focus on housing, education, finances, and obtaining essential documents. This is a very individualized process because no two set of circumstances are the same. No two transition plans should be exactly the same. The process is also youth-centered. They set their goals, supported by their caseworker, independent living specialists, and other caring adults in their life. Case managers and ILSs follow up to offer support and ensure the plan is carried through. We've talked about planning for youth as they leave care. Just as important is creating space for youth themselves to guide those plans. Our Youth Advisory Board is one way we make that happen. Georgia Peers Advocating for Change, or GPAC, is a youth advisory board made up of current and former foster youth ages 16 to 26. They provide input directly to DFAC's leadership, ensuring that policies and programs reflect lived experiences. This group works in partnership with the Youth Advisory Board at MAC, which is called Empowerment, and the AmeriGroup Advisory Board. In summary, DFACS provides a wide range of services and support for youth from their teenage years through early adulthood. Our focus is helping youth achieve stability, independence, and success. With that, I'll be happy to take any questions that you all have.
Thank you very much for your presentation. I have a few questions, and my committee may have some after that. My first question is, do you feel that we're pulling down all the federal dollars that are available for this population, or is there anything that we need to change legislatively to do that?
So I don't think the change is here. In terms of federal dollars, do you mean like the Chafee dollars? Are we using the Chafee dollars, the ETV dollars? Yes, we're using the funding. However, there are some limitations. Some of it is restrictive. So when you look at ETV, that's $5,000 per youth. And so we have a total of, I think our ETV allotment is $1.2 million. And in order for us to utilize all of that funding at $5,000 per child, that would have to be a significant number of young people that are enrolled in either college or a vocational program. And so the interest from our young people is not there yet. And so that's one of the challenges in pulling down that funding.
Yeah, I know we've got somebody in, for sure at UGA and some of the
Yeah.
other USG schools that we work with on working with those kids in particular once they're enrolled, but
Right.
that doesn't help get them enrolled. And I'm wondering if you have anybody on the technical college side that does a similar function of tracking those kids and helping them.
Not from the ETV side. Embark and UGA, they are responsible for all of our ETV awards to the technical schools as well. When it comes to the tuition waiver program, we do have contacts at TCSG that work with us to make sure our young people who apply for those particular benefits receive them.
Okay, and then I know you don't know the answer to this question, but I'm just going to bring it up. The Fostering Success Tax Credit Program, you probably don't have any information about how the success of that program, how it's doing, how many people are applying. I think that's got to come from the Department of Revenue, and I'm still waiting for that information from them, and we'll cover that at the next meeting. Hopefully I'll have some information from them. But do you have anything to say about the Fostering Success Tax Credit Program?
So yeah, I can't really speak to that piece of it, but I can speak to the impact that it has had on our young people. A lot of youth apply for supports through that initiative, and they are constantly met with all kind of services and supports. So it's been a very positive impact on our young people.
Okay, great. We'll try to get some numbers for the committee members before the next meeting. One other thing, this is a little broader question. I want to know if you feel like, one, are we making progress? And two, what would you recommend as far as changes? If you could wave your magic wand, what would you like to see? And you may not be prepared to answer that today, but do you feel like we're moving in the right direction? Because when I look at the numbers of, kids that are aging out, I guess that depends on the number of kids that enter the program to begin with, but I'd just be interested in your thoughts, because you work with these kids a lot, of how we're doing and are we making progress. The Celebration of Excellence was a great event, and I love going to that every year. But and those kids are moving in a great direction, but can you give us a bigger picture of how you think we're doing in terms of progress with that population in Georgia?
So I would say we are making progress. We have a lot of services and supports in place, some of which I just mentioned. We are also looking at different ways that we can increase the service array. And so currently, I would say yes, we're moving in the right direction. In terms of the magic wand question, it's kind of difficult.
Mary, anything that comes to
No, I
mind?
don't have anything to add in terms of magic wand. I mean, it really, I think I would say we could meet every individual youth's needs, right? And that's very individualized because they all come to us with different needs and different strengths, and being able to capitalize on all the resources we have now to meet those would certainly be my magic wand.
Other committee members have questions? Thank you so much for the work you do every day and for coming and talking to us. And we, as you know, work closely with the department during the year, kind of all the time, to on behalf of these kids. So thank you very much for pulling this information together for us. It's very helpful.
Thank you for having us.
Also wanted to point out that we have another piece of information in our packets that's from the Barton Child Law and Policy Center. And all of that has to do with foster youth to independence vouchers in Georgia. So that will be on the website as well. Next, I'm going to ask Devin Rudy, thank you, to come up and bring your friends. And Devin, the floor is yours, and you can introduce the other speakers.
All right, good morning. Thank you so much for having us and giving us the opportunity to make sure the voice of lived experience of transition age youth is heard. My name is Devin Rudy Johnson, and I'm here serving as the Youth Engagement Coordinator with the Georgia Empowerment Program, which is through the Multi-Agency Alliance for Children, lovingly known as MAC. Empowerment is a youth-led and youth-focused organization dedicated to training and empowering young people who are currently in or have lived experience in care. Our mission is to directly influence and improve the way policies are written and administered, ensuring that decisions affecting youth experiencing foster care are made with their direct input and lived experience in mind. Our motto is nothing about us without us. I'm happy to answer any questions about MAC or empowerment, and we're also happy to set up individual meetings to talk more in depth. But really, I would like to turn it over to our esteemed lived experience experts, Reginald Holloway and Kyra Stout. They'll be talking about their experience transitioning into adulthood from our child welfare system. And I'll close out with saying thank you again for this opportunity. By holding this committee, you are showing young people transitioning out of care not only that they matter, but you care. Reggie, I'll pass it off to you.
Good morning, everyone.
Good morning. I guess you're going first.
Yes, ma'am. My name is Reginald Holloway, and I'm a young adult who has close to 17 years of lived experience within the foster care system. I am also a graduate of the University of West Georgia with a degree in communications and a minor in sociology. As I aged out of the foster care system in 2019, one of the biggest struggles for me at the time was finding housing stability, as I was in college at the time and often relied on dormitory living. So much so that eventually I had to couch surf in the middle of my collegiate career as I struggled with housing stability. I mention this because one of the biggest challenges youth face today when transitioning from care is housing instability. In 2019, which is the same year I aged out of care at the age of 21, the U.S. Department of Housing and Urban Development created the Foster Youth to Independence Program, which offers up to 36 months or 3 years of rental assistance to young adults who have moved on from foster care. The money that is allocated is not directly from the government themselves, but from the state that applies for the funding. And according to the Department of Housing and Urban Development, data from fall of 2023, housing authorities in Georgia have received only 8 FYI or foster youth to independent vouchers total since the program began. By contrast, each of those years since the existence of it, Florida has received at least 75 vouchers each year. Only 5 states, all significantly smaller than Georgia, have requested fewer vouchers. With that being said, alongside housing, mental health is just as critical. Foster youth who have experienced the foster care experience have PTSD at rates that double that of war veterans. But the moment that we all turn 18, it is more difficult to obtain and find those resources. To be particular, many youth go without knowing about having to renew their AmeriGroup healthcare insurance that is needed to be done every year. Systems like that aren't just handed to us at the same level of support that match the trauma that we often carry from our experiences within foster care. I know what it feels like to struggle with mental health. Oftentimes enough, I relied on the free therapy that I received throughout my college career. And oftentimes enough, not having a safety net to catch you at times where you need it the most. So what helps, you may wonder? Community-based resources, programs like MAC, Up3 Atlanta, and local workforce initiatives that meet us where we are. They provide financial literacy, clothing, and basic needs, mental health resources, and real opportunities. When youth have that foundation, we don't just survive, we're able to succeed. So I'm asking you today to prioritize policies and give a closer eye to fully utilizing the federal housing vouchers, the expanding of access to youth-centered mental health services, an investment in resources and resource networks that give foster youth a real shot at adulthood. So I end by saying thank you all for listening. I really appreciate your time. And thank you for considering how your decisions could change the lives of young people like me. Thank you.
Thank you very much, Reggie, and congratulations on your successful completion of your education.
Thank you,
And
ma'am.
we wish you all the best. Questions from the committee? Yeah, Senator Parent.
Thank you. It's less a question than I'm trying to write down the list that you said at the end, and I missed, I think, a couple things. I got programs like MAC, and did you name another one?
Yes, ma'am.
Okay.
Up3 Atlanta.
Okay, thank you. And then youth-centered mental health services, fully draw down the housing dollars.
The housing voucher, ma'am.
The
Yes,
housing
ma'am.
voucher, thank you. Workforce supports,
Yes, ma'am.
and what am I missing?
That was what I had. That's all I had centered.
Then I did, okay. Thank you so much, I appreciate it, and yes, I want to echo the chairman and congratulating you on how hard you've worked and your success in the past, and I'm sure future.
Thank you.
Other questions from the committee? Okay, thank you very much.
Yes, ma'am.
Okay, you're up. Please introduce yourself. And be close to the mic as you can. We've got a lot of people streaming the meeting, so I want to be sure they can
I
hear.
do have a quite soft voice, so I'll project. So, good morning, everyone. My name is Kyra Stout. I'm a second-year biology major at Georgia State University, and I also have experienced Georgia's foster care system. So today, I want to highlight 2 issues that shaped my journey: education setbacks and housing struggles. So many transition-age youth in high school face academic challenges that delay graduation, prevent them from qualifying for the Hope Scholarship, and shorten the time they can access programs like the Education and Training Voucher. This is often due to placement instability. According to the Administration of Children and Families, something like 69.6% of youth in care experience moving between multiple schools and systems. Now, combined with higher levels of mental distress and limited support, the result is too many young people falling behind. For me, the impact was personal. Not all of my credits transferred when I changed schools, and I was held back a grade. I remember feeling ashamed so much that I have even avoided making friends because I didn't want my peers to know my real age. I tried to get back on track, asking guidance counselors about testing out of classes, taking AP or honors, or enrolling in dual enrollment, but most of the adults didn't support me. And this experience isn't unique to me at all because I shared my experience on a panel at the most recent celebration of excellence, and several youth had come up to me afterwards and commended me for sharing my story because they could relate as well. Even so, in my journey, I didn't give up. I graduated high school at 19 and enrolled in Georgia State at 20. But unfortunately, many foster youth don't make it that far. Statewide, only 11% of foster youth graduate high school and only 6% attend college, even though 70% say that they want to, according to a report published by Andrew Young School of Policy Studies at my school, GSU. Housing instability made these challenges even harder. When you don't know where you're going to sleep, it's almost impossible to focus on school. That's why I was really proud to witness the passage of House Bill 136, which includes the Fostering Success Act and the opportunity to be present at our governor's recent signing ceremony. In addition, I was also really excited to mobilize support for SB 85, the Georgia Foster Care Scholarship Program, to help cover tuition for public and private four-year institutions in Georgia. And now I also want to highlight programs like Max Leads program, Up 3 Atlanta, Faith Bridge, and the Insuro Foundation, because they have changed many lives. The Leads program has raised graduation rates to 73% for participating youth in 2020, according to the division's published article. Up 3 Atlanta helped me access a housing voucher within a month, while some of my peers relying on the independent living program waited up to 2 years or were denied entirely. These programs work because they combine housing, education, mental health, and workforce opportunities with meaningful youth engagement. These organizations have formed a dedicated continuum of care to provide holistic supports to youth and relieves pressure off of the overloaded, hardworking division employees, which makes their jobs much easier. Moving forward, I think we need policies that prioritize housing stability and education continuity. Specifically, we need to strengthen credit transfer protection so students don't lose ground with every placement shift. We also need to fully utilize the FUP and FYI vouchers and streamline coordination between DFACS and housing authorities so that way housing isn't a barrier to finishing school. And last but not least, we need to scale up proven education programs like the LEADS program statewide so more youth can achieve graduation and higher education success. So I want to thank all of you for listening and for including youth voices in shaping solutions that will transform outcomes for young people like me. And by creating this study committee, this shows your willingness to communicate with Georgia's foster youth, and we are so excited to cultivate our partnership going forward.
Thank you so much. We are I'm proud of your perseverance and also your engagement in the process. That's very important. And a lot of adults don't engage in the process that are much older than you guys. So I'd really appreciate if you would be willing to share your remarks with us because not all of our committee members are here. And Devin, can you coordinate that?
Yeah, absolutely.
Okay, I think that'd be really helpful. And thank you so much for sticking with our time constraints. I'm sorry we didn't have more time for you all to tell your stories, but hopefully it was great practice for you guys in public speaking, because that's a skill that will serve you well in later years. But congratulations on your success so far, and stay with it. You got a lot of people pulling for you. And Devin, thank you so much for coordinating this for us. Any other questions from the committee? Senator Payne?
I just want to say, y'all are amazing. And your maturity, the way you develop, but literally, and it's always amazed me when you see those that you just know they have a heart to overcome, to endure, to go down the hard path and know I'm going to be better on the other side. To have that hope and that sense of understanding. Like I said, you're just both amazing. Thank you for being here.
Thank you.
Thank you for being a part of the solution.
Hoping that maybe it's not today, but in between sessions, or maybe we will be getting this, I would love to have some more information on the specifics of the programs that you two lifted up, and kind of exactly how they engage and what y'all do.
Yes. So with some of the programs I've mentioned, like the LEADS program at MAC, so they partner with the division actually to get in contact with those students who need the education support, particularly in high school, and they provide resources like studying, support with books, any laptops. They also provide funding for field trips or even prom. And these things I think are really holistic and imperative to a young person's experience in high school particularly. And they also help with the transitioning process with college as well. And then with Up 3 is very holistic. It is founded by Miss Ann Corelli, and they provide wraparound services, which looks like providing transportation, housing, yes, and also education, groceries, things like that young people will need help with daily, as well as providing things that can help you to enrich you, such as like piano lessons and things that fuel young people's passions. So it's not only about surviving, but being well-rounded adults and that also is important for the mental health piece. And then with MAC, of course, so I've already highlighted the LEADS program, but we're also advocates with Georgia Empowerment, and how the engagement looks is we go to events such as Celebration of Excellence, we go to different group homes, we also do national work as well, and we train other young people with lived experience to be able to engage in the legislative process, as well as educate others about resources.
Thank you so much.
And we're happy to set up meetings to talk about any of the other programs as well. And we also have a number of other young people who have day jobs and were not able to make it today that would love to speak with you as well if you'd like.
Yeah, Devin, if you could maybe put together a short list of the organizations that you are working with, I think that would help us. And on the housing vouchers, we're gathering some more information on that, because I think there's a couple things that can be improved, one of which may or may not be the complexity of the application process. That's federal. And then the referral pipeline, I think DFEX is already working on that. So you'll hear more about that, I'm sure, at the next couple meetings. Senator Hatchett.
Yes, thank you, and thank y'all for bringing these concerns to us, and just echo what Vanessa said. Congratulations, y'all. I mean, we're proud of you guys for y'all to be here today after what you've been through. I want to ask two questions. One's directed towards you. When you were talking about the transfer credits,
Yes.
is that something that happens in high school, middle school, elementary school, or all the way through?
Yes. Yes.
Yeah.
And in my experience, it was really imperative that in high school, because that is where you're considering going to college and everything. So if I had some ideas about how we can strengthen those protections, because especially when a young person is moving placements and going from county to county, that is where it becomes really complicated. And then there are a lot of guidance counselors, unfortunately, who are not aware of some of the options, such as testing out of equivalent courses to attain that credit. So that way you don't have to retake the class if you've already taken it. Partnering with the College Board to learn more about attaining those credits, as well as I've spoken to several young people who were interested in dual enrollment as well. And in my experience, when I've expressed interest in these things, I felt like they were minimized, or, you know, I didn't feel like the adults were trying to steer me in that direction. So I would like to see more support for that as well. Does that answer?
Yeah. So I guess one of my questions would be, when you're transferring from, you know, County A to County B,
Yes.
let's say County A is on a block schedule and County B is not. You
Right.
may have completed your 10th grade biology class or chemistry class at A, but it doesn't transfer, or something to that effect. And I'm just trying to understand, are there things that we can do as far as legislation, or is it more education for guidance counselors to give them the tools that they need to make sure that they don't let students slip through the cracks, or that you lose credits that you should be given credit for?
That's a great question, because I've thought about those things, and I think it can be both.
Okay.
As far as equipping guidance counselors with the right tools to give to students who are facing that situation. And I don't know if this is a bit radical, but I would like to see where it could be a bit more standardized, so that way credit recovery and those issues can hopefully be minimized across different counties in Georgia.
Because you're, well, yeah.
Can you speak to the mic?
Yeah, if I could add, I actually worked in our MAC Leads program, and at one point it took me a month and a half to get a young person enrolled in school. And they were transferring from one county to another county. There were barriers within that school that prevented them from getting enrolled as soon as possible. So imagine you've missed a month of school and now you're trying to catch up.
Because when you're in that situation and you know you should have credit,
Yes.
and you're trying to talk to the guidance counselor, there's no one else for you to turn to. And am I right? Are you kind of like, I mean, I can feel the helplessness there, where you're trying to say, hey, I've got credit for this class,
Yeah.
and you're going to make me repeat a whole year.
You're kind of right. I've actually had teachers who tried to vouch for me, and what ended up happening was I was in the 10th grade when I should have been in the 11th grade, and some of my teachers recognized, oh, yeah, you're way too smart to be taking a 10th grade course, so we're going to get your classes changed to 11th grade courses. So they did kind of comply on that front. However, my grade was still a sophomore. So I was basically a sophomore taking junior level courses. So
And that impacts a foster child more than anything, because you've got
It
the
does.
18 years is when you age out.
yes.
And you're not trying to beat the clock, but you run out of could potentially run out of resources
Right,
at that point.
because even for other foster youth, some of them are placed 2 or 3 grades back, so they have to stay in high school even longer. And by the time that they do achieve graduation at maybe around 20, I think you have an age limit of maybe 21, but around 20 years old, you have until between 21 to 25 to access some of the education resources. And then you have to factor in enrolling in college, which I've also had a challenge with, attaining the right documents to submit to FAFSA and facing barriers in that process as well, which many of foster youth who try to enroll in college may also become discouraged during that process as well.
Well, FAFSA is complicated enough when you have help. So, but thank you. And then can I ask one more question too? When you were talking about housing when you were in college, is that something that is that the biggest issue? Did you face that during the summer when student housing wasn't available? Because I know if you're not currently enrolled, you can't live in student housing. Was that your biggest issue?
Yes, sir. It was. So if I'm allowed to backtrack here, a few weeks before my 21st birthday, when I aged out of care, I asked about housing resources at the time of what would be applicable for. I was advised to look for Section 8 housing or for the voucher, because the voucher at the time was geared towards youth who were still in care. So throughout that time, I did have to sign up for summer housing for summer classes for the sake of summer housing.
Okay, that was going to be my question. Did you sign up for summer school just so you could have a place to live?
Yes, sir.
Okay. And so a program that, like if you were to get an internship or something locally that would allow you to stay in student housing even though you're not currently enrolled in summer school, would that have been helpful for you?
Yes.
Okay.
Okay, I love that you told Senator Hatch that he was kind of right. He didn't hear that a lot.
That's a legal term, too.
So thank you very much for being with us today, and we'll look forward to some more information from you guys. And before we wrap up, I want to just remind everybody that there are sign-up sheets in the back if you're interested in participating by testimony or by submitting written information to the committee. We need your contact information on those sheets. And I want to thank our staff who have been great at setting this up and just making sure that it goes smoothly. And as promised, we'll have a web link with all the material that's going to be accessible to the public. So thanks to all of our guests for attending. And with that, we'll look forward to seeing everyone on September 10th, and we're adjourned. Thank you.
Thank you for all of your questions.
Thank you.